All right, hi, this is my assessment video, Tara Rodriguez. Okay. Hi, Jose. I'm the nurse for today. Nice to meet you. So if it's okay, we'll start with some questions, and that's going to take a little bit. Are you ready to go?
Yeah.
Okay. Can you tell me your full name, please?
Jose Rodriguez,
All right. And how old are you?
36.
And are you Hispanic?
Yes.
Okay. And is it okay that I do the assessment today? It's going to involve touch.
Yes.
Okay. And what is your reason for seeking care today?
Just a checkup.
All right. And what is your occupation?
I'm a service and parts director.
Okay. The patient appears the stated age, 36 years old. His level of consciousness is good, and his skin color is brown. And do you have any health history, any surgeries at all?
Yes.
Okay, and what is that?
I've had lithotripsy 2 times.
Okay, within the last year?
No.
Okay. When was this?
Probably about a year and a half ago or 2 years ago.
Okay, and any other health problems?
No.
All right. And are you having any pain today?
No.
Okay, and if you did have pain, we would use the PQRSTU methodology. And that would consist of P for palpitation, Q for quality, quantity, R for region, radiation, and S for severity scale and timing. And do you have any allergies to any medications?
No.
Do you smoke at all?
No.
Do you drink alcohol?
Occasionally.
Okay, and when you say occasionally, daily, weekly, monthly?
Monthly.
How many times a month?
Once or twice.
Okay, and do you use any street drugs?
No.
And does your family have any health problems?
No.
Do you have any spiritual considerations?
I'm a Christian.
Okay. And we asked you to leave a urine sample earlier when you came in, and your urinalysis came back clear. Do you have any pain with any urination?
No.
Okay. And how would you say your bowel movements are? Are they pretty normal? Do you have them regularly, at least once a week, twice a week?
Definitely regular.
Okay. And you feel like you're urinating okay? We already asked you that? Okay. All right. Almost done with all of the questions. All right. So your skin color is brown. What would you say that your diet consists of?
Just normal stuff. I eat a little bit of everything.
Okay. When you say everything, do you mean like
Meats, veggies, all that normal stuff.
Okay, and do you go out to eat a lot? Do you eat alone, at home?
I go out to eat every once in a while.
Okay, and are you single, married, divorced?
Married.
All right, and would you say that you're happily married?
Yes.
Okay. I apologize, I skipped a couple questions. And what about your daily activity or exercise?
I walk a lot at my job, probably about 12,000 steps a day.
Okay, and do you use any assistive devices to help you walk?
No.
All right, and how would you say your sleep is? Do you sleep fairly well?
Yeah, I sleep about 7 hours a night.
Okay, what time do you usually go to bed?
Around 10:30.
And what time do you wake up?
About 6:30.
And you feel well rested?
Yes.
Okay, wonderful. And tell me a little bit about your educational background.
I have an associate's degree in social sciences.
Wonderful. Okay, and what about the stress in your life? Do you have any stress in your life at all?
No, just normal stress from work sometimes.
Okay, and when you say normal stress from work, do you feel like you're able to handle that?
Definitely.
And what do you do to deal with that stress?
I have a couple hobbies that
Okay.
I do to de-stress.
What is your hobbies?
I work on cars.
Awesome. Okay. And do you have any depression, anxiety recently since the pandemic?
No.
Okay. And do you feel happy and satisfied in your life?
Yes.
All right. And do you ever feel unsafe at home in any relationship or at work? Like if you were physical abuse or harm or any type of emotional abuse or harm?
No.
Okay. All right, the patient has no physical deformities. Posture and position is well aligned. Facial expression is at ease and symmetry is equal. Mood and effect are calm and collective. Speak, articulation, pattern, content is appropriate. What is your native language?
Spanish.
Okay, and you speak English fairly well, as we already know. And you appear to hear clearly bilaterally. Your hygiene is clean and intact. Okay, so we're going to go over here and we're going to get your height and your weight. So if you'll just follow me. And we're going to step on the scale over here. And your weight is 190 and your height is 5'4". Your BMI, body mass index, is 32.6. And now we're going to use the Snellen eye chart. I'm going to ask you to cover your right eye and read me the first three letters.
E-F-T.
Yep. And then your left eye and read the first three letters.
E-F-T.
Okay, and now I'm going to ask you to have a seat for me, please. All right, and now I'm going to check your radial pulse, rate, and rhythm. Perfect, 98 beats per minute, strong pulse. I also checked your respirations, 13 breaths per minute, normal depth. And now I'm going to check your blood pressure in your left arm. And we're going to use a blood pressure cuff, putting that cuff on. And we're going to pump the cuff up. And blood pressure is 128/82, perfect. Now I'm going to go ahead and get your temperature. And your temperature is 98.6. And are you feeling any type of pain at all today?
No.
Okay. All right, so I'm gonna go ahead and stand in front of you if that's okay. And if needed, I would use a caliper to assess your skin fold. And I'm gonna go, can you put your hands in your, perfect. Okay, so we're looking at the hands here, and there's no lesions. They're clean and intact. Color and pigmentation look good. The temperature and moisture are warm to touch. The texture is a bit callous, but it's within normal limits. The turgor is good, and there's no lesions. And now we're moving on to the scalp, hair, and cranium. All right, take a look here. And the scalp, hair, and cranium are clean, intact, and symmetrical. And now I'm going to assess the face for the cranial nerve 8. There's symmetry, it's equal, and the expression is normal. And now I'm going to assess the temporal artery and the temporal mandibular joint. Okay. All right, will you open and close for me? Perfect. And now I'm going to assess the maxillary sinuses and the frontal sinuses. Have any pain when I press there?
No.
All right. All right, and now we're going to assess the eyes for the cranial nerve 2. I have a pen light right here, and I'm going to ask you to cover one eye. Okay, Now cover the other eye and keep the other eye open. All right, and we're gonna put the pen light, we're gonna check the extraocular muscles and the corneal light reflex. And look at me, please. Thank you. Thank you. Nope, just keep on looking at me. And also we would check the cardinal positions of Gay's cranial nerves 3, 4, and 5, and he would follow the pen light. I'm looking at the external structures, the eyelids and eyebrows and eyelashes, and then I'm going to check the insides of his eyes, the sclera, corneas, and irides. I probably didn't pronounce that right. Let me see. The conjunctiva looks normal. All right. And now I'm going to darken the room, and I would check your pupils. I would check, I'm going to look with an ophthalmoscope at the optic discs, the retinal vessels, and the macula and retinal background. So I would go ahead and turn the light off, and I would take my ophthalmoscope, and I'd ask you to keep your eyes open, and I would look. Perfect. Okay, and now we're going to turn the light back on, and we're going to check your ears, each external ear, and we would check for the position, alignment, auditory meatus, and also we would press down on the tragus. Does this hurt at all?
No.
Any pain?
No.
Okay. And I would take the otoscope and check the ear canal. I'm going to look inside of your ears now with the otoscope. And it was a pearl gray color, good position, integrity was good. And now we're going to have the hearing test for cranial nerve 8. I'm going to ask you to stick your finger in your right ear and then wiggle your ear and repeat what I'm saying. Can you hear me?
Can
Okay, and we're going to do the other side. Can you hear me?
you hear me?
Perfect. And then if I had a tuning fork, I would do the Vibra test and Renee test. And also we're going to check the nose. We're going to look for symmetry and see if there's any lesions present. And now we will do the sniff test, basically, the patency of the nostrils. So I'm going to press on one nostril and have you sniff. And press on the other nostril. Great. And with a speculum, I would go ahead and look in the nasal mucosa. Perfect. Everything seems intact. The septum and turbinates are clear. All right, we're going to check your mouth and throat, and we'll use a tongue blade and a pen light. So let's see. I'm going to sit down so she can probably see me a little better, the professor. Okay, so I'll have you open your mouth for me, and what we're looking for in here is we would inspect the lips and buccal mucosa, the teeth and gums, and make sure that we don't see any signs of any lesions, bumps. Keep your mouth open for me, please. And if we will look at the hard palate and the soft palate, make sure that they're intact. We'd also, if there's tonsils are not present, we would grade them. And then we're gonna look at the uvula to test the cranial nerves. Can you say "ah" for me? Good. And then we would do with the tongue blade. We would do. I'm sorry, I lost my train of thought. With the tongue blade, we would test the gag reflex, and then if needed, we would palpate inside of the mouth. So let's just pretend that we're doing the gag reflex, that I gagged you. Thank you. All right, and now we're gonna look at the neck. We're gonna look at the symmetry and see if there's any lumps or pulsations. We'll palpate, just make sure that we can feel the pulse and that it's strong. And we'd also palpate for the cervical lymph nodes, the posterior behind the ears, underneath the neck, the thyroid and clavicle. and the preauriculum. And then the carotid pulse, we would palpate one side at a time. And if needed, we'd listen if there was bruits indicated. The trachea will palpate in midline. And the neck, we're going to check the range of motion and muscle strength for cranial nerve 11. So what I'm going to have you do now, if that's okay, I'm going to have you tip your head forward and back, and each side shrug to each shoulders. Okay, and now you're going to go against my hand and against the other hand. Let's try not to fall asleep. And then now we're going to check the thyroid. So I'm going to go ahead and give you a glass of water. And I'm going to feel your thyroid. Can you take a sip of water for me, please? Good. All right, perfect. Thank you. All right, so if you had a gown on, can you sit up for me for a little bit? If you had a gown on, we'd ask you to open your gown, and we would check your lungs, posterior and lateral. So we would go ahead and look at the thoracic cage configuration to make sure that it was symmetrical. We would check the skin characteristics to make sure that there was no lesions, and the symmetry of the shoulder and the muscles. Okay, so I'm going to go ahead and check the symmetry expansion of your back. And I will also assess the tactile firmness and check for lumps and tenderness. So go ahead and take a deep breath for me. And say 99.
99.
A little louder.
99.
All right, and I'm going to check your spinal process. All right, and then we could percuss over the lung fields. And if indicated, we would measure the difference of the diaphragmatic excursion. We'll check for CVA tenderness, and we're going to listen to your breath sounds. And we're also going to be checking to see if there's anything abnormal. Take a deep breath for me. Another breath. Perfect. Another. Another. Great. All right, so now we're in the front and we're doing the chest and lungs interior. And so we're going to assess the skin characteristics, his respirations. We would check for any lumps or tenderness. And we would listen to breath sounds. And also, if indicated, percuss the lung fields, moving in a clock-like motion. Go ahead, take a breath in for me. Another breath. Another. All right, and one more breath. Great. Okay. Now we're going to check your range of motion for your upper extremities and your muscle strength. So bring your arms out side to side. And then let's go ahead and bring them out to our head. And then right behind our back. Perfect. Oh, down, sorry. And we would check the abtrochlear nodes. And so we would check the nodes to make sure that they're not swollen. The lymph nodes, if there's not any hard masses. And this will be a great time to check the breast area. For males especially, it's important. And so we would look for symmetry, mobility, or any dimpling. Have you had any discharge at all?
No.
No? Okay, I'm just going to palpate around here if that's okay. Okay, so you can do monthly. I'm going to palpate the axilla and regional nodes. And we're going to do as well the infraclavicular and subclavicular areas. And you can do your monthly breast exam as well, because men can get they can get breast cancer as well. So you can just do that in the shower just like I did. All right, and we're gonna check the neck vessels. So now I'll have you lie down for me. Don't fall asleep on me here. All right, we're gonna leave you like that so she can still see you. Okay, so we would be checking for, examine the neck vessels on each side. And what we're going to be looking for is the jugular venous pulse. We would check the sides, check the pulse, and measure for a ruler if indicated. Okay, and now we're going to move on to the heart. So what we're going to do is we are going to check the precordium for pulsations and heave. And we're also going to check for the apical pulse. Okay, so we could palpate for that. And we would check for precordium thrills. You would palpate for that as well. And then we could listen to the apical rate and rhythm. And we listen to the heart sounds, apex. You could listen to the small side of the stethoscope for any murmurs. And now we're going to check the abdomen for contour and symmetry to see if it's even and equal. And we would look at this. Can I lift your shirt up a little bit? Okay, we would look at the skin to make sure that there's no lesions. And we'd feel the umbilicus and pulsations, and we'd palpate. And we can also palpate in all four quadrants and percuss. And then we're going to listen to the bowel sounds and vascular sounds in each four quadrants. We would check for the aortic arteries, the renal arteries, iliac arteries, and femoral arteries. You're a pretty easy patient. All right. And while the patient's laying down, you can check the liver span in the right mid-clavicular line. You can percuss and palpate. And then you could check on the mid-axillary below the left chest for the spleen. Usually you cannot palpate the spleen. If you can, then obviously there's an issue. And then you could palpate light and deep with the abdomen. Are you feeling any pain at all?
No.
Okay. And you could palpate for the liver, spleen, kidneys, and aorta. And if indicated, abdominal reflexes. All right, now we're going to go to the femoral pulse. All right, I'll have you we're just going to leave it like this. So you would palpate. Do you feel any pain at all?
No.
Okay, so we're going to check for the femoral pulse and also feel for the inguinal nodes to make sure that they are within normal limits and that there's not any enlargement going on. Okay, so if it's okay, so I'm going to check the symmetry of your lower extremities. They look equal and intact. I don't see any lesions. Your hair distribution looks normal. We're going to go ahead and feel your popliteal pulse, your posterior tibial pulse, and dorsal pedis. And your skin temperature seems good. I'm not seeing any edema. And let's see, we're gonna go ahead and check in between your toes for any lesions. Everything looks good. Okay, and what I'll have you do is, can you go ahead, we're gonna have you take your heel and rub it up. Okay, and can you do the other side as well? What we're doing is we're checking for cerebral function. Perfect, thank you. All right, and we'll go ahead and sit up now. So now we're going to be assessing for lower range of muscle strength and hips. Well, we already did that earlier, and so that's good. So now we're going to be doing neurologic. Okay, so you feel all the sensations in your face? You don't have any numbness going on at all?
No.
Okay. And then we're going to assess for superficial pain. We're going to use a dull, sharp item. And what I'm going to have you do is I'm going to have you close your eyes and tell me, this is going to be the soft, and then this is going to be the sharp. I'm going to have you close your eyes and tell me when you feel the soft and when you feel the sharp, okay?
Okay.
Okay.
Soft. Sharp. Soft. Sharp.
Okay, and we're going to assess for light touch. You can go ahead and keep your eyes closed. And you feel this?
Yes.
Okay. And now I'm going to have you stick your hand out and tell me what this is if you can.
A cotton bud.
Okay, perfect. Okay, and so when he told me what the cotton ball was for, that was for the sterignosis. And can you go ahead and touch your finger to your nose? This is for checking for cerebral function. And we did the heel to shin, that was for cerebral function as well. Can you go ahead and follow my finger? Okay. And that was for position sense. And now we're going to take, I forgot the name of it, the little hammer, and we're going to check for deep tendon reflexes. So we would go ahead and use it on the elbow, checking for the biceps, and on the triceps, and for the brachial radius, and you have a reflex for the patellar, Achilles, and we would check for Babinski reflex underneath the feet. Sorry. Okay, and so now we're moving on to the musculoskeletal. So what I'll have you do is just stand up and walk across the room for me. And then you'll come back. Perfect. And if you could come back for me. Okay. And so now I'll need you to keep on standing. Sorry. So I'm going to hold the phone while we're recording here. Okay, and so let's see if we can put it on the ground just to kind of see your feet and what they're doing. So I'll have you go ahead and walk heel to toe for me, coming towards the phone. Heel to toe. Perfect. And tippy toes. And now on your heels. Can you do a shallow knee bend? And can you touch your toes for me? Okay, and now we're going to check for the Romberg sign. So if you'll come back and just stand right here. Okay, so for the Romberg sign, he would have his feet together, arms on side, and I would put my hands around him while standing. And I'll ask you to close your eyes. Perfect. And if the patient moved, that's a sign of Romberg. And then also, we're going to check your range of motion for your spine. So I'll ask you to touch your toes. Perfect. And then I'm going to have you lean back. Lean back into my hands. Just don't fall all the way back. Perfect. Okay. Did you have any pain at all?
No.
Okay. Well, that concludes of my assessment. So thank you very much, and thank you for your patience.